Hi, my name is Meredith Caldwell and this is Dr. Sally Ireland. We are doing our last video today. It is going to be our surgical assisting video. Our patient here today is Diddy. She is a 6-month-old female domestic short-haired. So a little history on Diddy. She was found when she was little. She's had a history of some chronic upper respiratory infections. So we're going to go ahead and start with our physical exam on her. We'll check everything out. We'll check her ears, check her eyes, check her mouth just to make sure she has no retained baby teeth. Go ahead and listen to her. Good girl. Oh, she's thumping. Good girl. Good girl. Okay. I'm gonna have Dr. Ireland listen to her as well as I throw my stethoscope on the floor. Just to make sure everything sounds good. To me it sounds fine, but we just want to double check. Make sure our lungs are clear, that everything's working right. Just being very, very good. Drugs are kicking in. Sounds good. Alright, and then we're going to go ahead and palpate her abdomen. We're going to make sure that we don't have any type of umbilical hernias or anything like that, which I do not feel. Let me double check. Looks good. Alright, so everything is good to proceed with our procedure today. She is going to be spayed. And then for post-operatively, we'll be sending home some buprenorphine for our pain management. And then for a few days, we're going to increase her lysine just to make sure that we don't end up with another upper respiratory infection. And we're ready to proceed. Here we have our materials for our procedure. We have our sterile surgical pack, surgical blade, and suture ready for our doctor. Then we move over here into our catheter placement, all the supplies that are needed. Then we have our warming device, which will be warmed in the microwave, but then we always put a layer between that and the patient. We never directly place it on the patient. We have our pediatric tubing. Our trough will be the next thing that we'll lay our patient in. We also have 2 different size endotracheal tubes tied to secure the tubing, our reservoir bag, and our laryngoscope. Alright, you'll see this again, but we want to check the levels of the oxygen to ensure that we have plenty of oxygen in our tanks. So we turn that on and the levers go up so we have plenty of oxygen. And then we check the anesthetic gas levels. Always have to have adequate levels, which our machine does. Here is a quick glance at our anesthetic machine, all the connectors that will give us our readings in the machine, and then we have our fluids, our lactated ringers that will be administered to our patient throughout the procedure. So a closer look at our machine. There is the monitor that will give us all of our readings. We have our pulse ox that will give us our percent oxygen. We have our ECG leads. They'll give us a nice lead and also show the heart rate. We have a rectal thermometer, and then the final black one is the blood pressure reader, which has specific cuffs that we will design for each of our patients. So now we're going to go ahead and set up our OR for surgery. First thing we're going to do is we're going to turn on our oxygen. We want to make sure you have an adequate amount of oxygen. The little gauges here will tell you if not. When it gets down to the red, obviously you need to refill it. This is our anesthesia machine here. We're going to go ahead and put everything together. So we have our bag here. It's our 1-liter bag, which is the proper size for our patient today. Then we have our pediatric tubing. We're going to attach that as well. Alright, and once we have this attached, we want to make sure too that our anesthetic level, if you can see, is adequate. It is in the middle, so it is adequate. If it goes down below this little mark right here, we will need to refill it. So we have adequate anesthesia, we have adequate oxygen, and now we're going to go ahead and pressure check our machine. So for that, we have to make sure that our pop-off is all the way down. All the way down. Alright, then we're going to put our thumb over the end of our tubing. We're going to turn our oxygen on. And then we're going to go ahead and fill the bag. Alright, and then we're going to watch the gauge up in the middle. Once it gets to 20, we want to hit it there. And as long as it holds there for at least 10 seconds, our machine is good. Just actually going past 20, so our machine is holding very well. And once you're done with that, you release the pressure by opening it back off the pop-off valve. And our machine will not leak. Alright, and then we also want to check our soda lime canister and our scavenging system to make sure that everything is properly connected and that nothing needs to be replaced before the procedure. Alright, so now we're laying everything out for our doctor. We have our sterile gown, our cap, our mask, we have our scrub that they'll scrub with, we have a sterile paper towel, and then we have their sterile surgical gloves that they will place after gowning. Always want to have everything out and ready for your doctor so that they can prep and get into the OR as soon as the patient is out and ready to go. Okay, so here is what the OR looks like when it's completely set up. We have our trough with our V and our warming system underneath of it. All of our attachments to the machines out, our laryngoscope, our gloves, our eye lube, tie, anything and everything that is needed. The machine is hooked up and set and ready to go. The fluids are set and ready to go. We just have to turn both the monitor and the fluid machine on, and we're ready to go. And then we also have our lighting above, which I'm turning on now, that will place over the surgical incision site for the doctor. We will place that for them. Okay, now that our patient is intubated and under general anesthesia, we're going to position her. You need to be very careful when moving the patient, watching the tube, watching the neck. We're going to slide her into the trough. She is going to be in dorsal recumbency. And then at the end of each of the tables, we do have leashes, or you can have different sorts of ties that we will put around each of her legs to extend them and secure her to the table. We also have our LVT Maggie in here monitoring her. While I'm prepping her for surgery, we always want to have someone in there monitoring heart rate, respiration rate, and keeping a good close eye on her. Go ahead and hook up all of her monitoring equipment that we need to. We'll lubricate her eyes. You'll see me kind of go around the videographer, unfortunately, to get each of the legs secured down. So it's we slip up above the hock, and then you'll see slip up above the hock, and then you twist and make a loop and pull down. And what you do underneath the table are these two little prongs, and you want to make a slip knot so you can quickly release it in case of emergency or anything like that. We do have Maggie helping here get her set up with the monitoring equipment and making sure that her heart rate is good, her respiration rate is good, that everything is up to par, and that she is doing well, fluids hooked up, all of that good stuff. It does take a little bit of time. Usually there'll be one or two of us in the surgical suite, but just for video purposes, we will. It is just me for now. So once she gets completely secured on the table, we're gonna go ahead and get ready to clip and prep the surgical site. So we take our clipper blade. We're gonna start at the xiphoid process, and we are going to go. In our hospital, we go about a clipper blade's width wider than the nipples. So we're gonna go with the direction of the hair, starting with, and we'll go ahead and clip down, removing any and all excess hair. Obviously, we don't want that in our surgical area. We do not have a separate prep area versus surgical area. We could prep her outside of the surgical suite, but unfortunately, it would not be possible because we don't have our anesthetic machines, and unfortunately, this little girl would not cooperate to be clipped with just a pre-medication on board. So once we've done our clip with the grain of the hair, you want to go against it. You want the skin to be as close to bald as you possibly can get without causing them any irritation. You need to be very, very careful not to cause any type of irritation to their skin. Owners do get upset about that. We do have little personal vacuums that we will use to get any and all of the rest of the excess off. We want to try to maintain aseptic technique. We want to keep this area as sterile as possible. So we need to just make sure that you do everything you possibly can to keep the area clean and sterile. So we've got Dr. Ireland here checking as well. Always having someone checking her heart rate, checking stuff like that. So you have to be pretty conscious of a lot of things that are going on even though you're prepping. So now that we've got her clipped, what I'm going to do is I'm going to do a pre-scrub. So I start with a rough scrub. It's just a chlorhexidine solution. And then I do a rough scrub with alcohol. And I'm going to alternate for at least 3 swipes or 3 alternations of chlorhexidine, alcohol, chlorhexidine, alcohol. We will do our final scrub once everybody is sterile and ready to go. But for right now, we're doing our pre-scrubbing or just our rough scrub. So like I said, you can do 3 passes or you can do 4 or 5, however many that you want. But a minimum of 3. Obviously, I've done a couple extra. After the rough scrubs, we're going to get everything set out for our doctor. So technically, we don't have a prep area either for our doctors. This is actually a separate examination area that has been bleached and wiped down. I'm opening everything to keep it sterile for opening the paper towel, opening the scrub. We are going to open her gloves. We're going to open her gown. Everything we need to make sure that we keep everything as sterile as possible. So for the gloves, the outside is not the important part. The inside is your important part. So you want to make sure that once it's open, that no dirt, debris, anything gets in there. Now we're opening our gown. All right. So I'm going to go, Dr. Ireland is scrubbed and ready for her gown. So I'm going to open the inside of the pack. Unfortunately, this does not go very well because I am not supposed to touch the inside, and the pack unfortunately will not open on its own. Normally it will fold back and then the doctor would grab the gown and then continue the process. So unfortunately here I am failing epically. at getting it to go down. So now that we have the pack completely open, Dr. Ireland, since she's sterile, she is the only one that can touch the inside of the pack, which would be our gown. She's going to grab the strings and then she's going to step back and she's going to open the gown up and all right. So, and it's backwards. So the main part that we want to keep sterile is the front portion of her gown. So she's going to go ahead and stick her arms in the gown. I'm behind her. She is not going to stick her hand through. Obviously, if she's grabbing the front, she's going to get her other arm in. Unfortunately, this gown is a little large for our doctor, so it does kind of consume her. Unfortunately, the strings of her gown have fallen in front. They technically are not sterile, so we need to make sure that those stay behind. So what I'm doing now is the back portion of the gown, which is the not sterile part, I'm going to go ahead and tie her up and get her ready so that she can finish gloving and then that we can get her into the surgical suite. We do have somebody still monitoring our patient in the surgical suite. We never ever want to leave our patient unattended. This is just us gowning with someone else monitoring. So now that I am sterile, we're going to do our final scrub. Chlorhexidine alcohol. We're going to start at the incision line and we're going to go in a circle rotating outwards. So pushing all of that dirt and gunk out. And this is technically not the proper technique. The hand that is dipping into the mixes should pass to the other hand, which will then do the scrubbing. I'm actually putting the same hand in both the chlorhexidine and the scrub, so I'm actually contaminating the scrub. So you want to make sure that you grab with one hand, pass to the other hand, and then do the scrub technique. So once this is completed, we will get ready to open all of our materials for our doctor for the procedure. For this procedure, it's going to be very quick and easy. It's literally going to be opening the pack, handing her the surgical blade, and dropping the suture. So when we open, we have the pack on our stand. We're going to go ahead and open it. We need to make sure we maintain the sterile field, so we're going to go ahead and break the tape that marks the pack. Open it, pulling everything outwards and down, making sure we are maintaining that sterile field. Our packs do come with sterile paper towels in them. She actually obviously doesn't need this, so we're just going to set that off to the side. Don't pay attention to that. Alright, so now Dr. Ireland can open the inside since she is the sterile person, obviously. And then the next things that I will give her are going to be her surgical blade and her suture, which you can either open or drop in the area. And our drapes are in our packs too, so there is no drape pack or extra, and gauze is in there, so there's no drape or gauze packs to give. So, opening the blade, not touching the inside, I'm going to pass that off to Dr. Ireland, and she's going to set it in the sterile field. And then as well, the same thing with the suture, opening and pulling outward and handing it to her to maintain our sterile field. Alright, our procedure is now over. This is where Diddy's going to wake up. This is her cage. She's got her bed. We've got our rice sock that's warming, so we're going to support her and stuff like that. She does have a toy in there. My son did send that with her this morning. They should not have those in the cage, but this is where she is going to be recovering from the procedure, which will obviously check on her multiple times until she's all the way awake. So, cleaning up, first just take any and all of the trash out of the pack. You want to look for any sharps, and if you find anything like that, you want to throw them obviously into the sharps container, which is the red box to the left. So we're going to remove our scalpel blade. You want to grab the needle drivers, and you actually want to always pull away from you, and then we'll deposit that in our sharps bucket. The rest of the instruments can now just be picked up, and they're actually going to be transferred over to the area where they'll be cleaned. But you can see me here just making sure that everything, as I'm cleaning up, you get all of the trash, you turn off the oxygen, you turn off the the anesthetic gas, which should already be off. You turn off the oxygen flow, you turn off the monitor, you put everything back where it needs to go, in case there is another surgical procedure that is going to need to be performed today. And for today, Diddy was the only surgery, so either way, you want to put everything back the way you found it, and clean and sterilely put it back the way you found it. The trash that we have there, the whole bag will be removed and disposed of properly. We've already taken out the fluids. We won't use the same bag of fluids on our next patient. We're returning all of our stuff that we need to its area. So we're going to take the tube and we're going to take the pack and set it in our area where we clean. Always setting the tube separate from the pack, because there are sharp instruments that can actually puncture the endotracheal tube and the cuff, which would cause a hole or a leak, and that would be not good, because then the tube would not be effective. So the whole trash is going to go, even though the bag is not full, and we'll dispose of that. We'll change out our bucket, which hangs under the table. And then the next part that we will do, and I did throw some gauze on the floor. It wasn't used, so we'll find something else to do with it. So the next thing to do is just to clean all the surfaces. We're going to clean the trough. We're going to clean our instrument stand. We're going to clean the mat. Under the mat, we're going to clean everything. You also want to make sure you clean the walls from any debris. If there's any blood splattered or tissue or anything like that, you want to make sure that's all gone. We want to sweep the floor, remove any hair, any dirt, any debris, and then use a brand new mop water, mop head, mop bucket, everything, and mop the floor before the next procedure begins. Our trough is stored just standing on the floor, so that is where it goes once it's clean. So we'll just finish cleaning all the surfaces, and just like I said, making everything in order for the next procedure. Don't want to leave a mess or blood or anything like that. That's disgusting, and that should not be how a surgical suite looks. It needs to be sterile. We are performing procedures that are cutting into tissue and into the body wall, so we need to make sure that everything is pristine and well kept. Alright, here is the solution that we're going to soak our instruments in, the Alkanox. And this is where they go. We have special trays that we soak all of our instruments in. And once they are done soaking and they've been scrubbed, they do go in our ultrasonic cleaning machine for 20 minutes. Alright, so with gloves on, we're going to clean the instruments. We do have a wire brush. It's kind of hard to see. But you want to get inside all of the areas of the instrument. Rinse that off, and then set it into the ultrasonic. I'm just going to do a couple instruments real quickly, just for time purposes. But, I mean, you want to make sure any tissue, debris, blood, anything that's on these is off, and that once they've soaked for the proper amount of time, you scrub them, and then they go into the ultrasonic cleaner. And then they're rinsed, and it goes into the ultrasonic cleaner. Okay, So now that our instruments are clean, we're going to go ahead and wrap them back in the pack so we can go ahead and place them in the autoclave. There are several things that you're going to need when you're wrapping the pack. For ours, we have an inner wrap that all the instruments will sit on, and then a first wrap, and then we will also have a second wrap. We have our indicator strip. This just lets you know that the steam has reached all the way to the center of the pack. We have autoclave tape. We go around the pack with this. We'll label it with what kind of pack it is, what color pack it is, depending on your practice, with your initials, the date, and then once it has been sent to the autoclave, it does change colors to black. So we have all of our instruments out here. Depending on which practice you work at, they do like their instruments laid out in specific ways. Here, our goal is just to make sure everything is sterile. So I like to take the thumb forceps and put them on one side, the scalpel handle on one side, and then I actually take the spay hook and I lay it across because it is one of the longer instruments. I do take the indicator strip and place it in the very center on the bottom, and then with the rest of the instruments, pretty much line them up based on size. Some places will have you line them up based on what the doctor's going to grab first, whether it's towel clamps or scissors or whatnot. The goal in this is just to make sure that everything is sterile. So we'll place all the instruments in our pack. This is not going to be pretty, just to let you know. Tell them to be quiet if they come this direction. Pretty much just stacking one on top of the other until I reach the end. And actually, I'm missing one more thing. I'm missing our drape. We already have pre-folded drapes. So once all the instruments are laid out, what I usually do is I put the gauze squares on top of that, put the drape on top of that, and then towel clamps on top of this. So now you're ready to go ahead and start folding. What I normally do is I start in one corner, and I pull up and leave a tab. You're going to do the same thing with the other side and leave a tab, and I sometimes will spin it as I go. Do the final one, leave a tab, and what you should have created is a little pocket here. So you'll fold the last piece up, and the tail, if it's long enough, should reach in. So that is your inner wrap. And then here we have our outer wrap, which has been cleaned. And we'll stick this one on the inside of this one. Let's make sure this is tight. I want to make sure it's nice and tight so that everything is steamed. So what I always do is the arrow will go this way so that when I wrap, the arrow will be this way, so everything is nice and tightly sealed. So same thing. Around.
I can't tell at this point what come out of our
Around. And you want to be pulling nice and tight as you're doing this. Make your little tail, and it should go up and tuck in. And your pack is wrapped. Now we take the autoclave tape, and what we do is we put it from one side, cover all the way to the other, and tear it off. So it's gonna come through there. And then,
Make sure I don't get hit.
and our yellow. This is our yellow pack, so we'll write yellow pack, and we'll write the date and our initials. And that's it.
No.
Okay, so now that the pack is wrapped, this is our autoclave. So it sits in a kind of a tight spot. So you slide the packs in here. You want them to be able to not be one on top of the other, anything like that. So to do this, you turn it on by hitting the start button. You turn it to the fill water. You do also want to check to make sure there's adequate amount of water, which you can do that on top. There's a little divot right there that you'll see. Once the water starts getting to that level, which it is, you go ahead and close the door. and you want to seal it as tightly as you can. This is going to get pressurized, so you want to make sure you seal it down tightly. And then once it is as tight as you can get it, you take the next knob and you turn it to 45, so it'll be 45 minutes in the autoclave, and then to steam. Once it's done, you'll turn it to the exhaust and you'll turn the machine off, and then once the machine has cooled off, then you will open the door. Okay, so it's been a couple hours since surgery, so we're going to do our physical exam on Diddy. We're going to check her color and her CRT. We're just going to give her a good look over just to make sure everything's going well. We're going to listen to her heart. Check her heart rate. I've got my watch over here checking, counting for 15 seconds, and then we'll multiply by 4 to get our heart rate. Unfortunately, Diddy is a little painful at this point. She is a little uncooperative. After we do that, we're going to go ahead and watch her breathe for 15 seconds. She woke up very well from surgery and she has rested comfortably since, but you can definitely tell by her behavior she is my cat. This is not her normal behavior. She's normally very lovey, and she does not feel very good at all. We're going to take her temperature as well. We want to make sure that our patient doesn't have a fever or anything like that. She's getting very, very agitated by this. Yep, she's mad. So, alright. And then we'll set that off to be cleaned. We're going to go ahead and give her first dose of buprenorphine on her mucous membranes. And then finally, we're going to check her incision just to make sure that everything looks good. And then we're all done. And she slapped me in the face. Hi, this is Meredith Caldwell again and Dr. Sally Ireland. This is our patient here, Diddy. She's our domestic short-haired female. She is 6 months old. She is presenting for spay. So right now Dr. Ireland and I are just looking through her chart history, checking her vaccine dates, feline leukemia, AIDS test, stuff like that. Her last distemper and rabies were given in September of this year, so they won't be due until September of next year. Her leukemia, AIDS test, which also includes a heart test in our hospital, was done in June of this year, and it was all negative. So she is all current on all of her vaccines. And then Dr. Ireland, we're going to talk about what we're going to do preoperatively for blood work for Miss Diddy. Your recommendations are?
We're going to do a complete blood count and a complete diagnostic profile for chemistry.
Okay, so our next step from here is we're going to perform our jugular venipuncture, and then we will show you how to run her blood work. Alright, so we are doing our jugular venipuncture on Diddy. She has already had her pre-medication. She is extended, and I've actually clipped, and I'm including the vein. I am going in, and her vein unfortunately is running. You do not want to manipulate as much as I do through this. Her vein is very, very superficial and very, very tiny, and it is running from me. She was uncooperative for a jugular stick with her sitting up. So I'm kind of new at these kinds of, so now I've got the vein. Do want to pull back slowly on the plunger, get an adequate sample, and then we're going to have Debbie hold off for the next 60 seconds. So we're going to remove the needle, and we have our two blood tubes, our green top and our purple top. Our blood does go in the green top first, and then into our purple top. And then once we have an adequate amount in each of our tubes, we recap them and then invert them gently to ensure no clots have been made. And then we will check our site, and everything looks good. Alright, so with our blood machines, we're going to do a complete blood count and we're going to do a complete diagnostic count. So first, the complete blood count is done off of our purple top. We invert it gently, and then there's a little button that has a test tube on it. You hit that, and then you start placing all of the patient's information in: the doctor, the patient ID, the name, how old the patient is, and whether they are spayed or not. And then you hit accept, and then you start, and then what it does is it spins it, and then I'll go ahead and do it. For the complete diagnostic profile, it is a rotor. So we pull out our rotor, we invert our top. This is the green top tube. There's a pre-measured dose for that, or measurement pipette that you'll use. You'll get your sample, you'll add it to the rotor, filling it adequately. You'll set it in that slot, you'll hit the close button, kind of like the CBC machine. We're going to select feline, obviously cat. We're going to put in her ID, then we're going to put in her name, and then from there the blood work will run, and when it's done, it will print out.